finishing out the female reproductive system, today we're going to talk about the disorders. So, all of these, I guess this one, which we usually call PMS, can kind of be thought of as a syndrome or a disorder, but most of these first three for sure, aren't necessarily syndromes or disorders in and of themselves. It's kind of more like vocabulary. So in the urinary system, remember we talked about like anuria and dysuria and oliguria and all those types of things that are symptoms of disorders. So these are going to be as well. So first is A. A or an means what? Correct. Without or lack of. Urea always means the flow or discharge. And then men think like menstrual. So without menstrual flow, it means you are not having a menstrual cycle. So this happens for several different reasons. First of all, before you've started and after you've ended. So before you ever achieve menarche, your first menstrual cycle, and during after menopause, you have amenorrhea. Also, there are various reasons that women can stop menstruating throughout their life. For instance, a lot of professional gymnasts experience amenorrhea because they are putting such physical demands on their body that their body won't have a menstrual cycle. Also, remember that we talked about in anorexia nervosa that if your calories are greatly decreased, your body will decide that it can't spare the calories to menstruate. So they exhibit amenorrhea as well. So menstrual flow again here, but dis means difficult or painful. So an abnormally painful menstruation. And then this is one of my favorite words, menorrhagia. I always think of it as a raging period. It is an abnormally heavy flow or heavy bleeding during the menstruation, so menorrhagia. And then PMS is PMS. It's a group of symptoms that some women exhibit slightly before or at the onset of their menstrual cycle. So a group of symptoms, things like irritability, cramping, bloating, general hating of life. This is one of my favorite gifs ever. Yes, let's just watch it again. So uterus, ovaries say, not today, Satan, pew, 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 rah. Okay, we'll move along now. Wait, one more. And next. So leading cause of the first real disorder we'll talk about is breast cancer, leading cause of death in women 32 to 52. It is cancer, so all your normal cancer options. Lumpectomy is a very conservative treatment where we just cut out the tumor. A lot of women choose to go for mastectomy, this being surgical removal of the breast, whether it's partial or full mastectomy. And then depending on stages and how progressed it is, they may also include radiation or chemo. So your best bet with breast cancer is to detect it very early on so that the smaller, always with cancer, the smaller the better. So monthly self-breast exams, which we'll talk about in just a second. Once you reach a certain age, and that age varies whether or not you have a family history of it. I want to say it's somewhere around like 40. Women start getting mammograms. This is a mammogram. It's an x-ray of the breast tissue so that they can detect tumors. You cannot get these when you're young because the breast tissue is still so dense that the x-ray won't really see through it. We have to wait until you get a little bit older and the breast tissue gets a little bit saggier. Cannot think of less dense. That's more professional. Less dense before we can do a mammogram and actually be successful in seeing through it. And then we can do ultrasounds of them as well if we think that something is there. So I had a friend get breast cancer at 19 years old. Please, please, please go ahead and start doing self-breast exams, ladies. So this is kind of the way that you do it. So the first thing that you want to do is inspect your breasts in a mirror, generally with hands on hips because it pulls up a little bit. This little area right here, which is like that little, it's almost like armpit fat, but it's not really. It's called the tail of Spence, and there are a lot of tumors that are detected there. So make sure that you go all the way up kind of to the axillary area, the armpit area. So look in a mirror, look for any changes, any asymmetry. I will say that it's pretty normal for one to be slightly larger or smaller than the other, but that's your normal. And if it changes from your normal, that's when we get worried. Then you lift your arms up and again, look for asymmetry or any pulling in or dimpling. And I'll show you examples of that on the next page. And then you're going to start to do the actual self-exam. So I will say that there's 3 different ways to do it. You should pick one and stick with it. So pick one and always do that way. So there's circular, where you start at the nipple and then kind of in a circle-like fashion, keep going out. There's up and down, where usually you'll start at the sternum in the middle. You'll go down and come back up and palpate down and come back up and palpate down and come back up. Or there's a wedge, which is kind of like how I vacuum. You go out and come back in and go out and come back in and go out and come back in. It doesn't matter how you do it, but just do it the same way every time. The first time that you give yourself a self breast exam, it's going to feel kind of weird because there are tissue. I mean, there's structures up under. You remember all the little lobules and the milk producing things. So you're going to feel little lumps and bumps, and that's okay, because the more you do it, the more you'll realize you're normal and you'll know if it's changed. The last thing it says is to gently squeeze the nipple and make sure that nothing comes out. Unless you are breastfeeding, no liquid should ever come out of your nipple. And then examine laying down. So a lot of times, especially physicians, if they give you a breast exam, they're going to do it in the supine position with one arm behind your neck. So the abnormalities that you're looking for, lumps, always a lump, right, is something to be slightly concerned about, especially if it's non-tender. Remember, if it hurts, it's probably going to be a lymph node, though I would still go to the doctor. But non-tender lumps we're generally concerned about. A pulled in nipple, and I'll show you another picture of this in a second. It's the tumor that's actually pulling it in. Dimpling, same thing. It's the tumor that's actually pulling it in. Drainage from the nipple in a woman who is not breastfeeding. Redness, rash, any sort of skin changes that aren't going away. Remember, from the integumentary system, you should consider all non-healing skin lesions, meaning if it's not getting better and it's a weird spot on your skin and it's new to you, consider it cancer until you go have a doctor, a physician, tell you that it's not. So this is the dimpling right here. You can see this pulled in spot. That's the tumor that's actually pulling the tissue in. And same here. This is an inverted nipple. I will say that some women have inverted nipples naturally, but if this isn't your normal, if this isn't your baseline, that can be the tumor that's pulling it in. All right, from breast cancer to cervical cancer. So remember, cervix is that bottom inch or so of the uterus. Cervical cancer is almost exclusively caused by HPV. This stands for human papillomavirus. HPV is the STD that causes cervical warts. You can get warts anywhere. You can get like warts on your hands and warts on your feet. Those aren't STDs, but the way that you get cervical HPV is through unprotected sexual intercourse with a man who has it. And just know that men do not show symptoms for the strain of HPV that causes cervical cancer. They will never know they have it. There's not even any way we can test them for it. But if you have unprotected sex, then you could end up with the form of HPV that causes cervical cancer. This is what happened to my sister-in-law, and she had cervical cancer at 35 and had to have radiation and chemo. So HPV vaccines called Gardasil is now out. FDA approved it maybe a decade or so ago. You get 3 of them throughout your early life. A lot of people don't want to vaccinate boys because boys will never have a problem from this form of HPV that it prevents. Just remember that it takes a boy to give it to a woman. So highly suggest that you look into this Gardasil. It's the first time that a vaccine actually prevents cancer. This is also why women have to get pap smears. The test in your curriculum will still say annual pap smear if you're sexually active, because that's when remember, you insert the speculum into the vagina and you open it up and you can see the cervix, and you take a little tissue sample with looks like a mascara brush, and you send it off to the lab. This is old data. We no longer do them yearly. We do them every 3 years now. So treatment is cancer. So chemo, radiation, and if it's bad enough, then they'll do a hysterectomy. Hyster means the uterus. This is different than, remember, oofer, the OOPH meant ovaries. Oophorectomy is when we remove your ovaries, and that puts you into menopause. Hysterectomy is where we just remove the uterus. If all we remove is the uterus, you do not go into menopause. We have to mess with your ovaries for that to happen. Endometriosis. So endometrium condition is what this breaks down to mean. So remember, the endometrium is that inner lining of the uterus that thickens and sheds each month for a female. If the endometrium is found anywhere else other than inside the uterus, that's called endometriosis. So usually where it's found is on the ovaries or on the outside of the uterus in the pelvic cavity. So here's a real picture. This is, you're like looking down and onto the uterus is right here. This is a fallopian tube. This is a fallopian tube. And these are your ovaries right there. So if you see just this tiny little patch of kind of red looking stuff right here, that's endometrium. That's supposed to be inside of here, not on the outside. And I know it looks really small and like it shouldn't cause a problem, but remember that it will continue to act like the endometrium. So it will continue to thicken and shed, but it can't leave. So every month this gets thicker, and then it tries to leave your body, but it can't get out because there's no opening. And so then the next month it's even thicker, and then the next month it's even thicker, and it just continues to grow. So the symptoms are, it can cause abdominal pain. It's usually the abdominal pain usually is associated with, meaning coming at the same time as either your menstrual cycle or during sexual activity. It can cause heavy menstrual flow. And sometimes we don't really know exactly why this happens, but we do think that sometimes what has happened is the endometrium is abnormally thick or heavy in a female, and it's so thick that it kind of backflows all the way out, and then that's how it gets into the pelvic cavity. It can irritate and damage your organs, and that's really where the damage comes. So if it's pissing off this ovary for month after month after year, eventually it will form scar tissue. And that can cause problems with infertility, meaning difficulty getting pregnant or difficulty staying pregnant, having a successful birth. And that's a lot of times, again, that's because it's pissed off these ovaries. So treatment. We can place these people on hormones that help to control the endometrium and make it not thicken every month. We can go in, and this is probably what's happening here. We're trying to surgically scrape off this spot and get rid of it. Or worst case scenario, we're going to have to do a hysterectomy, which is just to remove the uterus. Or if it's really, really, really bad, remember that what is making that endometrium thicken each month. And if the endometrium's all everywhere, cutting out the uterus itself won't help us. We'll have to do also an oophorectomy. Oopher is the surgical removal of the ovaries as well. And remember that when we take out ovaries, we will also put that woman into menopause no matter how old she is. Next is mastitis. So remember, a mastectomy was surgical removal of the breast, this meaning breast, and itis is inflammation. So this is an infection of breast tissue. I have only heard of this happening in breastfeeding women. So what happens is the baby is trying to breastfeed, and just bacteria from the baby's mouth or just the process of breastfeeding has either clogged one of those milk ducts, almost like in an adolescent or myself, how pimples happen when you plug the hair follicle and then it gets infected up under it. Well, in this, instead of the hair follicle getting plugged and developing an infection, it's the milk duct. Or sometimes breastfeeding dries out the nipple and it can cause the skin to crack open, kind of like, dry skin in the winter. And then the bacteria from the baby's mouth gets in there and it causes problems. So initially these women will present with flu-like symptoms like fever, achiness, things like that. But generally there will also be the associated breast changes. So a red spot on the breast, it is tender, it's very painful. And swelling. Edema means swelling. So a red, swollen, tender spot on the breast. This right here is mastitis. Treatment, I told you that it's usually bacterial, so antibiotics. I will say that the very painful part of this is that these women have to continue to breastfeed. It should be, generally we tell them that it's perfectly safe to continue to let the baby drink the milk, because the pH of the stomach, the acid in the stomach will break down any bacteria that's coming out. But if they choose not to do that, they still have to milk the breast. They have to express the milk, get the milk out, because it's a supply and demand system with breast milk. If you stop breastfeeding for the week or so it takes for this to heal up, then the brain gets the message that you don't want breast milk anymore, and so it will stop making breast milk. So it's super, super painful. These women have to keep breastfeeding or keep pumping and getting rid of milk so that their supply doesn't dry up while they're healing. PID, pelvic inflammatory disease, is something that happens in only women. There's a male version of this, but it's not pelvic inflammatory disease. So PID is only in women, and it's an infection of all the reproductive organs or the entire pelvic cavity. I've only heard of this happening after the woman gets an STD, a sexually transmitted disease, or an STI, same thing, just called an infection instead of disease, and has not got it treated, and so it back spreads up. So let's say they get an STD that affects the vaginal canal. They don't get it treated. It goes up. It affects the uterus. They don't get it treated. It goes out. It affects the fallopian tubes. And then just kind of like in endometriosis, how the endometrium got out, the bacterial infection gets out and then is all over the pelvic cavity. Anything that puts you at risk for getting an STD puts you at risk for getting PID. So having sex with multiple partners, having unprotected sex, any of that. Symptoms, sometimes mild or none. In the early stages, this won't cause any symptoms. You just have the infection that's back spreading. But once it gets bad enough, they start to have achy pelvic pain, heavy and irregular periods. Again, it's a bacterial infection, so eventually they will develop a fever. And if it goes long enough without getting treated, it will scar the organs like the ovaries because it is irritating them, and eventually scar tissue will form. Complications. This puts you at a really high risk for having an ectopic pregnancy. And I don't think we've talked about this yet, but we'll talk about it when we talk about conception and pregnancy. Ectopic means somewhere other than where it's supposed to be. So pregnancy is supposed to happen inside of the uterus. The baby is supposed to implant inside of the uterus. However, remember that fertilization actually took place in the fallopian tube. So Mr. Sperm met Mrs. Egg in the fallopian tube. Well, if you have scar tissue in the fallopian tube, it's kind of like putting spider web up in the fallopian tube. And so the egg gets fertilized there, but it can't keep moving. It gets stuck in the scar tissue. And so then it implants in the fallopian tube. And it's super dangerous because you can't grow a baby in your fallopian tube. Baby has no chance of surviving. And if you don't recognize it and have a physician terminate the pregnancy, baby will always die. And then if you don't fix it, mom will die as well because the fallopian tube will pop and she will bleed to death internally. So should have been showing you on this picture, might be. So again, here's a scar tissue, possibly from pelvic inflammatory disease. So the egg got fertilized in here, but then sperm can get to it because sperm is tiny, but remember the egg is huge. So then egg can't get out. It implants here, and then the female will die if you don't fix it. It can also cause infertility if the egg and the sperm can't ever meet. Sometimes these people will have chronic pelvic pain for months or even years after they get the STD fixed. And again, it's generally caused by the bacterial infections like gonorrhea and chlamydia. So we give you antibiotics to treat it. PCOS, polycystic ovarian syndrome. PCOS is where you have many much, cysts in your ovary. So we don't really know what causes it. It's idiopathic, but it does tend to run in families. We think it's genetic. And you have imbalanced hormones for who knows why. So here, this PCOS, remember lupus when I said there's like 8 gajillion different symptoms, but most people have like the butterfly rash and some like joint ache type of things. So PCOS is similar in that it can present a gajillion different ways, but there are some classic symptoms that most people do tend to have. And those classic symptoms are infrequent or irregular periods. There's no rhyme or reason to when they're going to have their period. They have difficulty getting or staying pregnant. That's what infertility is. They have cysts in their ovaries. I mean, come on, people. We call it polycystic ovarian syndrome. So they have lots of cysts in their ovaries. Here is an ultrasound of an ovary right here. And it should all be this type of graininess. All these big black holes are cysts because the fluid-filled cyst is ultrasounding clear, basically. So obviously, this woman ain't working with a working ovary. She's only got like this much ovary tissue that actually is normal. It's just cysts everywhere else. So that's causing all sorts of problems. It causes women to have excessive hair, like facial hair and body hair, similar to like men. And then acne, really bad acne. So again, we suck at, if we don't know what causes it, we don't know how to fix it. So most idiopathic things we suck at treating, and this is no different. It's symptomatic, and remember that means we just treat the symptoms. So we might put you on birth control to help regulate your menstrual cycle. We might, tell you to put you on acne treatment for the acne. Go get a wax for that upper lip type of deal. We really suck at treating PCOS. Again, especially the infertility, it should make sense that if you're not growing like with normal follicles, you see this is a follicle and then they've ovulated. So this one is the daisy, the corpus luteum. This one doesn't have room. It doesn't have room to grow and to ovulate and things. So it's very, very difficult for these women to get pregnant. This is one of the leading causes of infertility in America. Toxic shock. Okay, so we only have 2 more, and they are fun ones. Toxic shock syndrome, sometimes called TSS, is when, okay, so remember with tetanus. Tetanus was a bacteria got into your body, and if you don't get oxygen to it in an anaerobic, a without oxygen setting, it started making a toxin, and that toxin got into your bloodstream. And that's why tetanus only happens with puncture wounds, because if it was just a little scratch or a cut, plenty of oxygen would get there. But a puncture wound is so deep and it kind of seals itself off that oxygen didn't get there. Well, this is a similar process, but it's just a different bacteria. So this happens when bacteria, usually staph, and staph is all over your body. Staphylococcus aureus is the type of bacteria that is everywhere all over your body, but it just usually doesn't cause a problem. But here, it got somewhere that it couldn't get air to, and so it started making a toxin that got into your bloodstream. In this case, it's the vagina. So this usually happens, I've only seen it happen with misuse of tampons, meaning you kept a tampon in for too long. The tampon had some bacteria on it that it got just from being inserted. So it touched your skin as it was going inside of you. And so now there's bacteria up here. You left it in for so long that it's not getting any air because you've plugged the vagina with the tampon. And so it starts to make this toxin. And the toxin gets into your blood and it causes all sorts of problems that can kill you pretty quickly. This used to happen more in like the 70s and 80s. They started making these synthetic, nasty material tampons, and that they were like, hey, you can leave these in for 12 to 24 hours with no problem. Except the problem was you died because you started getting toxic shock syndrome. So now we try to make them out of cotton and things that breathe a little and get some oxygen to them. And we tell you to never wear them for more than a few hours. I will say that how quickly you can develop this is different in everyone. So I had a student who had this, and she went out on the lake and she left a tampon in, maybe 8 hours, 10 hours, something like that, just all day while she was out on the lake, and ended up with toxic shock syndrome and in the ICU and almost died. So symptoms: sudden severe vomiting and diarrhea. The student I know who had it, she thought she had food poisoning from like potato salad or something that they had on the boat on the lake. It was out in the sun all day, and she thought, oh crap, the potato salad must have gone bad, and now I have food poisoning because this is the first symptom. But after that, you get abdominal tenderness, hypotension, your blood pressure plummets, and that's because you're starting to go into shock. All your blood vessels open wide up, and so you no longer have enough pressure to circulate the blood. So then you go into respiratory distress, you start to struggle to breathe. Eventually they'll go into renal failure, their kidneys fail because you're not getting blood to the kidney because the blood pressure is so low. And eventually they will go into a coma and die. So she went downhill pretty quickly, ended up in the intensive care unit, and was there for several days while they were trying to fix it. So to fix it, we give you antibiotics, because remember that it was a bacteria that started it to begin with, and lots of blood pressure medicines. Because of this hypotension, we will pump you full of fluids and give you medicines to try to make your blood vessels constrict, because remember here they've dilated, they've gotten so big because of that toxin. That's how they respond to the toxin, that we give you medicines to help narrow them, to help constrict them. All right, last one that we're going to talk about is a vaginal yeast infection. That's right, people, today's the day. So we talked about thrush earlier, and that was a yeast infection in the mouth. Oh, so anyone can get that. Um, only women can get the vaginal yeast infection because only women have the vaginal. So it's usually, and this was the same thing with thrush, it was caused by antibiotic use. So you took antibiotics, the antibiotics killed all the bacteria, but the bacteria was what was keeping yeast in check, keeping yeast from over dividing. So now that we've killed all the bad bacteria, but also all the good bacteria that was keeping yeast in check, the yeast over proliferate. So prevention, generally, if you have to take an antibiotic, you have to take an antibiotic, so that sucks. But there are other things that you can do. Staying dry, because yeast want a warm, moist environment. And so if you can try to eliminate it being too moist, that helps. So change out of wet bathing suits immediately. Wear cotton underwear. Cotton breathes and lets oxygen in. All those types of things help. Symptoms: severe vaginal itching and burning, like drives you crazy, can't concentrate on anything other than the itching and burning that happens to the vagina. Also, leukorrhea. This is one of the nastiest things ever. Leuko means white, and urea means discharge or draining the flow of something. So you have this white cottage cheese looking drainage that comes out of the vagina. A thick white cottage cheese drainage. Let's see if we have a picture. This is actually cottage cheese. I'm not gonna do that to y'all. I'm not gonna show y'all that picture, but just know it looks a creepy, weird lot like this. And it smells yeasty. It smells like yeast because that's what it is. So treatment is an antifungal because yeast is a fungus. So there's a couple different ways you can do this. You can, it's a cream that you can put vaginally, or it's a pill that you can take orally. So the pill, a lot of times women who are given an antibiotic, they will just go ahead and give them this pill to prevent it as prophylaxis so they don't end up getting a vaginal yeast infection. If you already have one, the pill that you take can take a long time. This also presents with vulvitis, the labia get really swollen and inflamed and painful. And it can be really just uncomfortable, and it can take a long time for this pill to kick in. And sometimes you have to take another one 4 or 5 days later because it didn't do the trick. So really the best way to treat it is this cream that you insert vaginally. So it's almost like a plunger system. You can think of kind of like the dispenser for a tampon, but instead of a tampon being in it, it's this cream, and then you insert it into the vagina and you depress the plunger, and it pushes the antifungal medicine deep into the vaginal cavity. I will say that it's best to do this at night when you're just going to sleep for a while and stay laying down, because if you do it during the day and then you stand up and you're walking around, just the sheer force of gravity is going to push the medicine out of you, which is unpleasant and not helpful. All right, that's it, guys. That's all that we're going to do today. I got nothing. Bye.